Hello, teacher. This is Pablo Hipólito Guzman, and today I will continue with the unit 14 that called symptoms and signs. Okay, describing problems. The problem which a patient report to the doctors are called symptoms. For example, pain or nausea. Signs are what the doctors finds, also known as findings, on examining the patient. For example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaint, doctors said Miss Farnsworth was admitted complaining of chest pain. In case of notes, the abbreviation CO is used. For example, CO, chest pain. Presentation. Patients say they went to see the doctors. Doctors say the patients presented. The symptoms which cause a patient to visit a doctors or to present is called the presenting symptoms, presentations complaints, or presentation. For example, he presenting symptom or presenting complaint. Chest pain. Also, he presented to his GP with chest pain, and another one is the usual presentation is chest pain. Talking about symptoms. Symptoms: tiredness, lethargy, fatigue, lassitude. Meanings: loss of energy, and patient can say, I feel tired all the time. I feel completely worn out. Lately, I have been feeling completely exhausted at the end of the day. The other one is malaise, general feeling of being usual, and patient said, I feel unwell. I don't feel well. I have been feeling off color for 2 days. I haven't been feeling myself for a week, and I haven't been out of sort all the day. Another one is anorexia, loss of appetite. My appetite is very poor, and also I have been off of my food for days. Weight gains, increase of the weight. I have put on 8 kilos in the last year. Oh, also, I have gained 5 kilos. Weight loss, decrease in weight, and also the patient can say, I know eating any less than usual, but I have lost a lot of weight recently. And constipation, hard, infrequent phases. My motivations are very hard. I have been quiet, constipated lately, and I'm not very regular. Okay, let's continue with the exercise now. Okay, complete the table with the words from C opposite. Put a stress mark in the front of the stressed syllable in each word. The first one has been done for you. Okay. Exhaustion, exhausted. Fatigue, fatigued. Lethargy, lethargic. And tiredness, tired. Make a word combination, the 14, part 2. Make a word combination using word from each box. Look at A, B, and Z, opposite to help you. Complain of, of color, out of, present with, put on, are one on. Okay, the 14, part 3. Complete the sentence with the correct form of the verb present. A 67 years old man presented with a 9-month history of increasing shortness of breath. The most common presenting symptoms is loss of consciousness. Cranial artery may present as a fever without any obvious cause. The patient usually presents with a severe sore throat. The presenting symptoms in this patient could perhaps be due to renal failure. Other conditions with a similar presentation include acute cholecystitis, reduced ground is an important presenting complaint, or celiac disease. 2 months following presentation, the patient was able to walk. Okay, let's continue with the 14.4. Read the patient's description of her symptom, then completed case report. Look at C opposite to help you. It was well until a few months ago. In the beginning, it's just feel of a color and bit tighter, but lately I have been feeling completely worn out at the end of the day and not eating anymore than usual, but I put on my 9 kilos in the last year. My motivation are hard and my hair has started to fall out. K13. A 50 years old housewife who had been well until 4 months previously presented of tiredness and lethargy. She had put on 9 kilos in weight in the year before. She presented to health GP, although she denied eating more than usual. She was tired and she noticed that her hair had started to fall out. Okay, that's the first part, that is the 14. Thank you for seeing my video. Okay, teacher, let's continue with Unit 15 that called blood. Okay. Part A, full blood count. In the investigation of the blood disease, the simple test is a full blood count. A full blood count measures the following is a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and the platelets, and also the thrombocytes. The volume of the cells and the erythrocytes demonstrate a measurement of how quickly red blood cells fall to the bottom of the sample of blood. Part B, anemia. Anemia is one of the common diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of the red cell, of blood production, for example, because the diet is lacking of deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin, and it is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? Students, most probably carcinoma of the bowel with chronic blood loss. Professor, was again that as a diagnosis? Student, well, he hasn't had any change in his bowel habit or lost weight. Professor, what else will you include in the differential diagnosis? Of severe anemia in a man of this age? A student, he might have leukemia of some sort of a plastic anemia. but that's rare. It will be very unusual. Another cause is iron deficient, but he seemed to have a adequate diet. Professor. Okay, now there is another case of anemia, which I think is more likely. Students. Chronic bleeding ulcer. Professor. Yes, that's right. But what about pernicious pernicious anemia? Can you exclude that? A student. Well, he's got none of the typical neurological symptoms like paresthesia, parsi, pernicious anemia. Jordi Pams, the medical student from Barcelona, has made some language known in this textbook. Pernicious anemia is a condition in which there is atrophy of the gastric mucosa, which consequence features on intrinsic factors, production and vitamin B12 malabsorption. The onset insidious with a progressive increase in symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis is sometimes present with a symmetrical paresthetic in the finger and toes, early loss of vibrant sense, progressive weakness and ataxia. The plant may the purple ball. George's language note. Onset beginning insidious, slowly developing, pallor, lack of color, meal, slate, jaundice, bilirubemia, breakdown, division into smaller parts, bone marrow, soft tissues in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continues to develop, purple, purple can be filled with the hands. Okay, thank you so much. Let's continue with the exercise right now. Okay, opposite meanings. Find words in the box with opposite meanings. Look at B and Z opposite to help you. Words and oppositive. Adequate, inadequate, unlikely, likely, mild, severe, common, rare, insidious, sudden, and for, against. Okay, let's continue with part 15. Part 2. Word combination. Make word combination using a word from each box. Bone marrow. Medical diagnosis. Insidious onset. Iron deficiency. Pernicious as anemia, progressive increasing, and vibration sense. Part 15.3. Complete the sentence. A 29 years old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Bleakness may be caused by vitamin A deficiency. 3. The blending and purple are caused by a normal platelet function. 4. The white cell count is normal, so one can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to jaundice. There was a tender mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with an intravenous fluid. The anemia may be due to increase the red cell destructions. Part 15.4. Complete the conversation. Professor, what is against the diagnosis of pernicious anemia of physical examination on physical examination? A student. The problem started quickly, suddenly, so it didn't have the typical insidious onset. He doesn't have any skin jaundice and he doesn't have symmetrical paresthesis on absence, vibration sense, and I could feel his spleen. Professor, what about his tongue? His tongue was normal and not inflamed or short. Painful. Okay, teacher, now we will continue with Unit 16, called bones. Some common English name for bones. I will say first the English name and then the anatomical name. Okay, skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, shin bone, tibia. Part B. Fractures. A fracture is a break in a bone. Some of the different types of fractures. Green stick. Displaced. Comminuted. Impacted. Open of compound. A pathological fracture is a fracture in the acid bone. A fatigue or a stress fracture is due to repeated minor trauma. For example, long distance marching or running. Part C. Treatment of the fractures. When the fragments of a broken of bone held and joined together, they unite. Union may be promoted or helped by reducing the fractures, replacing the refragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by dissection, either external, for example, a spleen or plaster of Paris can, or internal, for example, a pin or a plate are and screws. A displaced fracture which is not reduced may result in a malunion, incomplete or incorrect union. The verb reduce had several meanings in medicine. For example, to make it smaller, I think we had better reduce the dose of your tables. Also, in surgery, the return to an anatomical position, hernia can normally be reduced by manipulation, and in chemistry, to remove oxygen or add hydrogen. Okay, let's continue with exercise that is 16.1. Label the diagram. Skull, show bone, spine, rib, breastbone, collarbone, shoulder blade, jib bone, kneecap, and shin bone. Okay, 16.2. Match the type of fractures. Open with the D. The broken pieces are separate. Communicated with C. The bone is broken into several pieces. Displaces with A. There are in break in the skin. Green stick with B. The bone is blend in the occurs mainly in children. And implanted with E. The broken pieces are pushed together. Let's continue with the 16.3. Complete the textbook extract. Reducing. A fracture involves striving to return the bones to as near to their original position as possible. If a fracture is allowed to hold in a displaced position, the fracture will malunion, but it may go on to non-union. Over to you. You have a disease, a stress fracture of the tibia in a young female dancer. Now, will you explain how to the case of manipulating this condition? Okay, teacher, that's all for the part 16. Let's continue with the 17. Okay, teacher, and this is Pablo, and now we will continue with the unit 17 called childhood. Milestone. Childhood is the period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestone in a child development and the age of which the usual occurred. Sitting by 9 months, crawling by 12 months, and words by 18 months, and walking by 18 months also, and talking by 3 years. B. Common infectious diseases. Disease and common names. Morbilliae and rubella. Common name, measles. I will say first the disease and then the common name. Okay. Rubella. Shimar measles. Varicella and chickenpox. Parotitis and mumps. Pertussis and whooping cough. And acute laryngotracheitis, croup, and also scarlatina and scarlet fever, rheumatic fever and rheumatic fever, tetanus, lockshot, poliomyelitis, and polio. Okay, let's continue with part C. Scoliosis diseases. Scoliosis diseases. A medical student had made some language note which reading her textbook. Coeliac disease is a disease of the small intestine caused by sensitivity to gluten. It can present any age but infancy. It appears after waiting to the cereal containing gluten. The clinical feature included diarrhea, malabsorption, and filter tray. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Okay, language notes: sensibility to, having a negative reaction to, waiting, changing the diet from milk only to solid food, clinical features, the symptoms and signs of diseases, malabsorption, poor absorption, malnutrition, poor diet, driven, glow strongly, distension, swelling, delayed, later than expected, feature, when something that is expected does not happen, and start size especially high. Okay, let's continue with the exercise. 17.1. Complete the table. I'll say first the verb, later the nouns, and then the adjective. Okay, delay, delay, and delayed. Develop, development, and develop. Distend, distension, and distended. Fail, failure, and failing. Nourish, nourishment, and nourished. Okay, babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to an enlarged liver. A small amount of alcohol in pregnancy can affect fetal development. Normally, from measles can be reduced by better nourishment. And delay is one of or more of this dilestone might be the first sign of disease. Okay, let's continue with 17.2. Complete the sentence. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been young. Someone who is not very tall is said to be a short stature. The stage in child's development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Okay, let's continue with the part 17.3. Write the common English name. A large parotid glands, mumps. 2. Difficulty opening the mouth, locked shut. 3. Rash at a large posterior occipital notice, German measles. Paracetamol caused with vomitings, jumping cup. Populous and versicle first on track, chicken pox. 6. Cough and cold followed by rash, measles. 7. Short throat and rash, scarlet fever. 8. Swollen joint and hair murmur, rheumatic fever. 9. Fever followed by muscle weakness, polio. And 10. Cold with Tridor, crowd. Okay, teacher, that's all about the Unit 17. Let's continue with Unit 18. Okay, teacher, let's continue with Unit 18 that call it the endocrine system. A. Excesses and deficiency. An excess, too much, or a deficiency to a little of circulating hormones cause a wide range of medical condition. For example, hyperthyroidism, and hypothyroidism, where there is an excess or hormones on one form of treatment consists of giving the patient something which inhibits the production of that hormones and is the use of cortisol to treat the hyperthyroidism when a hormone is a deficient. Treatment may be by replacing therapy, for examples, injections or insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. B. Negative feedback systems. TRH. Thyrotrophin release in your mouth. Insecreted is the hypothalamus and trigger the production of TSH, thyroid stimulating hormones in the pituitary. TSH stimulate the TSH receptor in the thyroid, the increased synthesis of both T4, thyroid, and T3, triiodothyronine, and also to release stored hormones producing increased plasma levels on T4 and T3. T3 feedback on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion. C. Goiter. An enlarged thyroid gland is called a goiter. The enlargement may be difficulties in moving most of the gland or located limited to a particular area, as in a solitary nodule. The increased blood flow in diffuse enlargement, for example in Graves' disease, may give rise to a purple thrill, vibration filled with the hands, and also audible fluid noise heard through at her the stethoscope over the gland. D. A letter of referral. Mr. Davis' doctors has referred her to a endocrinologist. Endocrinologist. Dear doctor, I will be grateful if you will see this 50 years old woman who has lost 20 kilos in weight in the speed of eating more than usual. She described herself as a overeating and as a fear she thought she weight loss was due to this. But more recently she has developed palpitation, diarrhea, and head intolerance. She had noticed that her hands have a tendency to shake. Her symptoms suggest hyperthyroidism, and this way confirmed by my examination, which revealed an enlarged thyroid and red sweaty palms, and find three more of the hands, operating more active than usual, palpitations, awareness of rapid or irregular heartbeat, head intolerance, inability to cope with high temperatures, and fight tremor, very slight involuntary movements. Okay, teacher, let's continue with the exercise. The 18.1 completed the table. I will say first the verb and then the nouns. Okay, inhibit, inhibition, produce, production, release, release, replace, replacement, secrete, secretion, stimulate, stimulation. Okay, let's continue with the 18.2. Completed the page, passages. Pools of GnRH, gonadotrophic relation hormones, are released from hypothalamus and trigger LH and AFSH secretion from the pituitary LH stimulation, testosterone production from Leydig cells of the testes, testosterone feeds back on the hypothalamus to inhibit and FSH stimulate the serotonin cells in the seminiferous tubules to produce mature sperm, and the inhibit A and B. Inhibin cause feedback on the pituitary to decrease FSH production secretions. Okay, let's continue with the 18.3. Complete the sentences. 1. A diffuse change affect many parts of the organs or glands. 2. A localized change affect only one part. 3. His diet is deficient and iron. He doesn't get enough iron. Assessed T3 and T4. Increase the basal metabolic rate. Let's continue with the 18.4. Match the symptoms. Diarrhea with D. Are you bowel normal? 2. 80 more with C. What is your appetite like? 3. Health intolerance. A. Do you prefer hot weather or cold? 4. Overactivity with A. Are you able to see and relax? Fifth, yeah. Palpitation with G. Have you ever feel your head breathing rapidly or irregularly? 6. Weight loss with B. Is your weight steady? And 7. Tremor with F. Do your hands shake? Okay, that's all about the part 18. Let's continue with the part 19. Okay, teacher, let's continue with the unit 19 that called the eye. Part A. Part of the eye. Okay. Eyebrow, eyelid, eyelashes, pupil, and the iris. Okay, let's continue with the part B. Examination of the eye. Examination of the eye. Yeah. Here is the extracts from textbook description of our how to examine the eye. Look for squint, strabismus, drooping of the upper lid, ptosis or oscillation of the eyes, nystagmus in the lid black. The upper eyelid move irregularly instead of mostly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, they are regular in outline, they are abnormally dilated or constricted, they read normally to live and accommodations. The test the reaction to accommodation. Ask the patient to look into the distance, how your finger is from or their nose, and ask the patient to look at it. The eyes should come together or converge, and the pupil should constrict as the patient look at the finger. Check also for cataract Okay, part C, retinoplastic, retinopathy. Hypertensive change in the retina can be classified from grade 1 to 4. Grade 1, silver wiring of the arteries only. Grade 2, grade 1 plus arteriovenous nipping indent, indentation of vein where they are crossed by arteria. Grade 3, grade 2 plus flame shape the gemor ships and cotton cottonal SUT dates. Grade 4, grade 3 plus papilloedema. Okay, let's start with the exercise. That the first one is 19, complete the tables. 19.1, complete the table. I will say first the verb, then the nouns, and then the adjective. Accommodate, accommodation, and accommodative. Constrict, constriction, and constricted. Converge, convergence, and conversion. Dilate, dilatation, and dilated. Drops, dropping, and droppy. Oscillate, oscillation, and oscillating. React, reaction, and reactive. 19, part 2. Match the picture 1 to Z. 1. A croins. 2. With C. Irregular pupil. B. Dilate. 4. F. Constrict pupil. 5. Cataract. And 6. With A. Dropping of lips. And the 19.3 completed the extract. Retinocuspic. Examine the retina with a ophthalmoscope is possible with the pupil dilated to obtain the maximum view to look for papilloedema and for flame shape hemorrhages and cottonal. Exaudits assess the status of the four silver whiting and note the presence of any narrowing as well as nipping at the arteriovenous crossing. Okay, teacher, let's continue with the unit 20 that called the gastrointestinal system. A. Examination of the abdomen. Here is extract from a textbook description of how to examine the abdomen. Now, in the abdomen, that is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting, dullness, percus, or tap first with the patient lying supine, flat on their back, as the patient to lie on one side and percus again. If fluid is present, the dull note here of percussion muse. Parpit, each region feeling for tenderness, pain when touched or masses the purple enlargement of tissue. Note also any guardians or rigidity shown by contraction or the abdominal muscle. Guardianing may be due to the tendencies or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebounded tenderness is pain when the palpating hand suddenly removed. It is sign or peritonitis. Listen to the vowels sounds. Okay, let's continue with part B. The feces. There are several words for feces. Doctors sometimes said there was blood in the stool. Have you faced black stool? Also, patients sometimes say my motion have been very loose lately. Bowel movement used to refer to defecation. Have you moved today? Have you have a bowel movement today? Okay, bowel habit. It is a medical expression meaning the pattern of defecation. Have you noticed any change or your bowel habit, or have you often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard infrequent stool or diarrhea, frequent soft or liquid stool. Normal stool are brown in color and semi-solid or formed. The consistency or degree or hardness or softness can be shown on a scale like hard, formed, semi-formed, soft, and liquid or weightedly. The color can vary from black due to altered blood as is a melanin to yellow-gray or even white. Melanin on Melanin stool are often described as tarry, like tar, the black sticky substance that used to raw making the tools may be red when fresh blood is present, blood that can only be detected with a special test. It called fecal occult blood. When there is high fat content, the tools are pale and are sometimes described as a cry-colored. Tools that are large in volume are described as bulky. A bad smell is described as a foul of offensive. Okay, let's go with the exercise 20.1. Complete the case report. Physical examination revealed a teen girl with a slight pallor. She was now obviously dehydrated. The temperature was 38 Celsius, pulse 100 minutes per minute, blood pressure 110/80 mmHg. Examination of the rest of the cardiovascular respiratory system was normal. The abdomen was not distended, and there was generalized tenderness, which was most marked in the right lower quadrant as one associated with the guardian, but no rigidity. There was no rebound tendencies, and no masses were filled. Vowel sounds were reduced. Okay, but let's go with exercise 20.3. Match the features to the doctor's questions. Number 1, blood with F. Have you passed black stools? 2, with bowel habit. With A, how often do you open the bowels? 3, changing the bowel habit. With B, are you going to the toilet more often than normal? 4, bulk. With G, is the size of the amount of the tool normal? 5, color. With A, what about the appearances of the tools? And 6, consistency. With C, are the motion hard or loose? And 7, offensiveness. With D, do the motion have an unusual smell? And that's it. Okay, teacher, let's continue with the unit 21, the college gynecology. Okay, part A, the female reproductive system. 1, fallopian tube, ovary, vagina, and neobium, neck or womb. Okay, let's continue. Part B, menstruation. A period is the common name for a menstrual period. The onset of the menstruation is known as a Menarche, the last menstrual period, is commonly abbreviated in doctors' know like AMP 2/52. Ago means the last menstrual period was 2 weeks ago. The menstrual cycle, or length and frequency of period, is usually written in the form of 4-28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as a prolonged. The term heavy period means excessive blood loss, menorrhagia, often with the passage of clothes, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally about the age of 50, is called the menopause or climacteric. Is everyday English known as the change or life, or simple the change. Symptoms of the menopause is clouded whole flusher, sudden sensation of heat, and night sweat. Part C. A gynecological consultation are period regularly? How often do you get them? How old were you when you started to get them? When was your last period? How long do the period last usually? Will you say they are light or heavy? Do you get clothes? Do you get period pains? Is there any discharge between the periods? And what color it is? Part D. Contraception. For women's methods to prevent pregnancy included the oral contraceptive pills, known as the pill, the diaphragm, and the intrauterine devices, EUD or copper coils. Condoms are available for both men and women. Let's go with the exercise. Exercise 21.1, medical terms in English, in simple English. 1. Hyster- sorry, hysterectomy, surgical removal of the womb. Menorrhagia, very healthy periods. Salpingitis, inflammation of the fallopian tubes. And the 4. Cervical biopsy, taking a small piece of the tissue from the neck of the womb. Exercise 21.2, notes about the patient. Menarche, age 12, menstrual cycle every 4 weeks, LMP a week ago, menorrhagia 4 or 5 days, dysmorphia not really, and discharge a little while. 21.4, case 15. At 45 years old woman had been having prolonged period lasting 4 days, which the passage of clothes for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a Cooper intrauterine devices was fitted. She had had a normal pregnancy when she was 25. Okay, that was all about the Unit 21. Let's continue with Unit 22. Okay, teacher, this is Pablo. Let's continue with Unit 22 that called the hair and circulation. Part A, shortness and breath. Shortness of breath or breathlessness is dyspnea. At first, this is caused by exertion, physical activity such as climbing stairs, but in several cases it may be present even at rest. A patient who is breathless when lying flat, orthopnea, for example, in bed, will tend to sleep raised up on two or more pillows. The abbreviation SOBOUE stands for shockness of breath on exercise, or unexertion, or unesphor. Patient said, I get terribly short of breath climbing stairs. Doctor can ask, how many pilots do you sleep on? B. Heart rhythm. The normal resting heart rate is 75 to 70, 65 to 75 beats per minute. In athletes, it may be as low as 40 beats per minute. Is extreme athletic activity, the heart rate can go as high as 200 per minute, sorry. The heart rhythm may be regular or irregular. In a irregular arrhythmia, there may be earlier beeps which interrupt the regular premature beeps, or the rhythm may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregularity, they describe the symptoms are palpitations. Case 4. A 22 years old student was admitted to a hospital with a long history of heart problem. She had been increasingly tired with shortness of breath or excitation, orponia and palpitation as a mitral valve replacement. Had been carried out 3 years previously, and these have stabilized the symptoms of her features, but was followed by episodes of atrial fibrillation, which had been particularly severe for the 6 months before admission. C. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each minute for the body needed. It may involve the left side of the heart, right side, or both. In left heart failure, the main symptoms is breathlessness. The symptoms of right heart failure included peripheral edema or swelling. Begin in the feet at ankle. This is known as a pitting oedema. When a finger is pushed into the swelling, it causes small depression or pit. Aorta, tricuspidal valve, tricuspidal valve, pulmonary artery, pulmonary veins, mitral valve, and septum. Okay, let's start with the exercise. So quickly. 22.1. Complete the conversation. Doctors, what seems to be the problem? Patient, I have been getting palpitations. Doctor, how long have you have them? Patient, for about 6 months, but I haven't had ear problem for a year, with tiredness and shortness of breath. In the end, I could walk more than 100 miles without having to stop. I had to sleep on 3 pilots. I had a mitral valve replacement 3 years ago, and that is improved things for a while. Okay, let's continue with 22.2. Wall combinations at risk. Atrial fibrillation, cardiac output, heart failure, on effort, on execution, pitting edema, premature beeps, Okay, let's continue to 22.3. That got it, word a patient will use. Dyspnea, shortness of breath or breathlessness, arrhythmia, palpitation, orthopedia, shortness of breath when lying flat, and also the last one is edema or swelling. And the last 22.4, complete the case report. Case 13. A 60 years old woman attend her GP surgery complaining of breathlessness on exertion. This had been increasing over the previous 8 months until I was producing problems at around 1500 meters, walking on the level. There was no history of chest pain. She had had several episodes of fast irregular, which latest 20 to 30 minutes and were associated with some shortness of breath. She have noticed some swelling of her ankles by the end of the day. This disappeared overnight. That's it about Unit 22. Thank you so much. Let's continue with Unit 23. Okay, teacher, let's continue with Unit 23rd that called the hair and circulation, part 2. A. Physical examination. Medical examination is normally carried out in 4 stages. Inspection, looking, palpitation, feeling with the hands, and percussion, tapping with the fingers, and the last one, auscultation, listening with the stethoscope. B. Examination the hair and circulation. Look at the lips, tongue and nails for the blue discoloration of cyanosis, maybe central or perimetral. Inspect the hands for clubbing, feel the radial pulse and the ribs and note the rate. For examination, 70-9 and read on regular or irregular. The pulse may be irregular in force, as well as the time check that the other perimeral pulse are present. Measure the blood pressure and assess the jugular venous pressure. JBP. Pulpo the chest for the apice beer. The normal position is the fifth left intercostal space, 1 centimeter medial to the mid-clavicular line. Feel for any trills. Hair size may be measured by percussion. Listen for murmurs and other abnormal sounds, for example, flexion rubs beginning at the mitral area. Murmurs may be soft or loud, and harsh murmurs are loud and loud. Systolic, in the middle of systole. Pansystolic, lasting for the whole of systole. Early dystolic, early day as mid dystolic and late dystolic. Okay, let's start with the exercise of the 23.1. Complete the table. Put a straight mark in the front of the straight syllable. I will start first with the verb and then with the noun. Auscultate, auscultation. Examine, examination. Inspect, inspectation. Palpate, palpitation. Percuss, percussion. 23.2. Put the step in the order. 1 with the D. Look for clubbing, impection. 2 with C. Feel the radial pulse, palpitation. 3 with A. Locate the up speed, palpitation. 4 with F. Note any thrill, palpitation. 5th, pressure the hair size, percussion. And 6, B. Are there any murmurs? osculation. And then 23.3, complete the test. On examination, she was pyrexial with a temperature of 38.5 that she was short of breathing. Her pulse was variable between 100 and 180 and was irregular at times at force. Her blood pressure was 130-80 and her GBP was up 5 centimeters, showing normal movement with respiration. Her perimedical pulse was up all present and there was no central or perimedical synapses. Her apex beat was displaced to the arterial axillary line but still in the fifth intercostal space. Her hair sounds were very interesting. When she was initially examined, it was noted that she had pansystolic and mid-diastolic murmurs hair based at the apex. When she was examined some hours later, there was a harsh perimedical friction rub all over the precordium. Okay, that's it about Unit 23. Let's continue with Unit 24. Okay, teacher, let's continue with Unit 24 that called infections. Let's do it. A fever. A medical student has made some language notes on a case report. Case 45. A 24 years old man presented with a fever, which he had for 3 days. On the third day, he had a severe attack of fever, which sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever. Infection with Epstein-Barr virus at the age of 18 years. He had returned from Africa 3 weeks previously. Fever. Pyrexia, also remember POO, pyrexia or unknowledge origin. Fever, also known as a temperature. I have got a temperature. Adjective, feverish or febrile, and pyrexial, and opposites, equal of a febrile or a pyrexial. Some symptoms of fever: sweating and rigors, severe shivering and sensation of coldness, also known as chills. B. Microorganisms. Infections differ from other diseases in a number of aspects. Most important, they are caused by living microorganisms such as viruses or bacteria that can usually be identified through establishing the etiology earlier in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable. Unlike many known infections, degenerative are chronic disease. Communicabilities, another factor which differentiates infections from non-infectious disease transmission of pathologies organisms to other people, directly or indirectly, may lead to an outbreak or epidemic. Finally, many infections are preventable by hygienic measures by vaccines, especially live attenuated vaccines such as rubella vaccine or by drug prophylaxis. For example, chronic to prevent malaria. Microorganisms include bacteria, viruses, fungi, protozoas, such as parasites that cause malaria. Another general word for these pathogens is microbes. Patients often refer to microbes as germs or bugs. C. Sources and spread and infections. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, or from outside sources, exogenous, often another person who may be either suffering from an infection or carrying a pathologic microorganisms. Carriers are usually healthy and may harbor the organisms in the throat. For example, diphtheria, bowel, salmonella, or blood. Example is hepatitis B or HIV. The incubation period is the period between the infection of the tissues by pathogens and the apparition of clinical features in the infections. The period or infectivity is the time that the patient is infectious to others. Okay, now let's continue with the exercise. Let's do it. The exercise 24.1 match the two parts. 1. In 1988, saw the UK launch of Live attenuated with J. Measley, mumps, and rubella vaccines. 2. Chickenpox, varicella is a common infection, a disease of childhood. 3. Rabies has included incubation, a period ranging from 4 days to many months. 4. The patient remained febrile age with pico or temperature of 39.5 Celsius. He was admitted with a 4 days history on influenza type symptoms of fever with B. rigors, myalgia, and major general malaise. 6. Quite a proportion of patients who recover from hepatitis B C becomes carrier of the virus. 7. The Central Park or Africa is in the midst of an epidemic of AADC. 8. Measley rubella is most the infections during the catarrhal stage. 9. Lyme disease is caused by transmission G of B. Burgdorferi from animal to man by exotic ticks. 10. POO stands for pinorexia or unknown origin. 24.2 Complete the case report. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who was recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 40 days in this case. The patient admitted he had not been talking prophylaxis regularly. The diagnosis was confirmed by presence of parasites in his blood films. 24.3 Complete the sentences. 1. An infection which can be treated successfully with antibiotics is curable. 2. Another word for an epidemic is an outbreak. 3. Bacteria and viruses are examples of microorganisms. 4. Someone whose temperature is normal is a febrile. And 5. The common infections for Epstein-Barr virus is known as a glandular fever. Okay, teacher, that's all. Thank you so much for seeing my video. Have a wonderful day.